All right, we're going to talk now about fetal physiologic changes in labor. The normal range for fetal heart rate is 110 to 160 beats per minute. It's on the higher end of that and even a little above that occasionally early in gestation, but it's usually on the higher end of that, and then it's on the lower end with later gestation. So if you have someone in preterm labor, you're going to expect fetal heart tones that are on the higher end of this. If you have someone that's maybe 42 weeks, you might even see them under that 110. So it's higher early, lowers later. It's very common when we're monitoring the fetal heart to see acceleration in labor. We're going to see in response to contractions, in response to fetal movement, we may see the heart rate get higher temporarily and then come back down. There are some types of decreases in heart rate that are normal in response to what's going on in labor in response to contractions. And we're going to talk about those in depth in another section. So there are some types of decelerations that are normal. There are some things that cause abnormal decelerations or abnormal changes in the way the fetal heart responds. So when we talk about fetal heart monitoring, you're going to see what that looks like. So sometimes if we don't have enough placental perfusion, or if the cord is compressed, you're going to see some changes in the fetal heart that reflect that. Labor also causes changes in the respiratory tract, and this is important because they're going to have to come out and breathe. So the catecholamines produced in the fetus by labor actually promote lung function after birth. So that's why sometimes babies are a little bit wetter. Their lungs are just a little bit more gunky after a C-section. That can usually be handled as long as everybody's healthy, but you do see a little bit more of that. They have a little more difficulty transitioning. When the fetus is born, the chest is compressed as it goes through the vaginal canal. And then at birth, when the thorax exits, it rebounds. And that rebound actually can help encourage the first breath. And there's several things when we get to newborn, we're going to talk about all the things that encourage that first breath. But I want you to think about we squish and then it rebounds, and that actually can help inflate the lungs a little bit. During labor, the fetal oxygen pressure decreases because we're cutting off oxygen with all those hard contractions. And carbon dioxide increases. pH decreases. They can get a little, they move a little more toward the lower level of pH, and their bicarb level decreases. All of that tends to trigger breathing outside, but respiratory movements increase on the inside. So all of those things are getting the fetus ready to breathe when it's born. The next section, we're going to talk about maternal changes.